Hi guys, today I will discuss two symptoms. These are not diseases. They can be symptom of various diseases. First of all, headache. Headache is of different types. It can be cluster headache, tension headache, migraine headache can be related to sinus. It can be related to teeth problems, and it can be more sinister reason. It can be because of any intracerebral tumor or cerebral abscess. So tension headache is most common headache, and then migraine and cluster headache. So we will discuss here today migraine and cluster headache in detail. As far as migraine is concerned, migraine is very severe headache. It is of moderate to severe intensity, and it has got nausea and vomiting associated with it. And it has also got photophobia and phonophobia, and it is diagnosed when other causes of headaches they are excluded, and it is also sometimes associated with aura. And there are certain foods which precipitate migraine, like alcohol, caffeine, skipped meals, then physical exertion, bright light, excessive noise, different type of smells, and lack of sleep. Now, as far as the treatment of migraine is concerned, we give non-steroidal anti-inflammatory drugs, and we can give 5-hydroxytryptamine agonist, which means triptans. Sumatriptans and other triptans, they can be used. Since migraine is associated with nausea and vomiting, so that's why intranasal or injectable triptans, they are also available, and sometimes they are mixed with antiemetic. As far as the prophylaxis of migraine is concerned, if it is occurring more frequently, then we can give beta blocker, and we can also give topiramate, which should not be given in the females of childbearing age, because it decreases efficacy of oral contraceptive pills and amitriptyline. Then after that, if it is not helping, then we can also do 5 to 8 sessions of acupuncture over 3 months. Sometimes menstruation it aggravates migraine, so we recommend such women that they should take regular riboflavin, and they can also take zolmitriptan or forvitriptan before menstruation. Pizotyphin is no longer used for the prophylaxis of migraine because it causes increased weight. Then is the cluster headache, and this is a special sort of migraine which is more common in males, and it is associated with unilateral eye congestion, rhinorrhea, and nasal blockage. And usually it comes in the form of clusters, and it occurs after every 4 to 12 weeks. And each attack of headache it lasts from 15 minutes to 2 hours, and this attack it tends to occur at the same time in the day. As far as the treatment is concerned, we can give hyperbaric oxygen or subcutaneous sumatriptan, and prophylaxis is usually done by calcium channel blockers and weaning dose of corticosteroids. Then after that, other sort of headaches they depend upon that what is the underlying. For example, if it is because of infected sinus, patient will be referred to ENT surgeon, and if it is because of eye problem, glaucoma, or any other infection, eye doctor will be involved. And if it is because of teeth problems, then obviously the dentist will be involved. And if it is because of space occupying lesion, obviously we will refer the patient to a neurosurgeon. But the most important headache which we come across here is that of temporal arteritis, which is also called giant cell arteritis. This headache is an emergency because it can lead to permanent visual loss. It usually occurs in people over 50 years of age, and it is associated with headache, jaw pain, and visual problems. And it is also associated with polymyalgia rheumatica, means that the patient can have stiffness of the shoulder muscles. So diagnosis is made by the typical signs and symptoms and clinical presentation, and then ESR is usually greater than 50. Biopsy of temporal artery is sometimes inconclusive because of skip lesions. So basically, diagnosis depends upon the clinical features. And if there is a visual problem, we do not delay to give corticosteroids. And tocilizumab is also approved as an alternative to steroids.